Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself. Welcome back to the Beauty Equation. I'm Dr. Christelle Oliver-Dussault.
And I'm Dr. Harpreet Lotay.
And I'm Amanda Manholt.
Last time we spoke about the sad face, and today we're moving on to the saggy face that sometimes women will come into us and tell us, I woke up and I felt like my face had melted off. Like there was a candle and it just, burnt all night and now everything is hanging down. I think you've had a lot of those concepts.
The joys of getting older.
You have a fantastic analogy that I've heard you use many times about the mattress and the bed frame. Do you want to share that with everyone today?
Yeah, well, I think it's important for people to understand that, aging is not one dimensional. It's not like one thing. It typically is making them feel like they woke up and went, oh my gosh, what happened? It's not just their skin. So if we think about the structure of the human head, I think about bone, and bone is that, if you think about a bed and you've got a bed frame, you went to IKEA or wherever, you got your Allen key and you put it together. So the hard part that the mattress sits on, you can sort of think of that as representing the bone or the skull. Then we have the mattress, and the mattress is that nice squishy thing that you get to lay on. And it, I think, represents the fat of the face, and I guess it would also have to do with muscle, but it's the soft, the squishy, the part you can squish. And then on top of that mattress, we have a duvet, and that would be the skin. So when we've lived a life and been in the sun and lost weight, gained weight, our heads shrunk because we're getting older, all of these things can be affected. And when, we've lost underlying support or the bed frame has shrunk, it can change how the mattress sits. And when the mattress gets a little lumpy and squished down, it can change how the duvet looks. And then, the duvet, your dog can jump on it, like at my house, and there might be paw prints on it, dark spots.
Yeah.
So that's kind of a global thing. That's the dummies version of what you guys do.
I think that's a great analogy.
It is, yeah. And it really highlights, oftentimes we'll see that in women who have just gone through the menopause, and it really highlights that shift when you have that estrogen drop off, when your ovaries are no longer producing estrogen, you stop getting periods, your collagen drops off by about 30%. So it's no wonder that you wake up one day and you feel like everything has changed, because it has.
Mm-hmm. Yeah,
Totally.
absolutely. And, we have gradual volume loss in all the structures, like you said, Amanda. So we do lose volume in our skull, like a significant amount. And then on top of it, as we're losing that collagen, it's kind of like you do hit a tipping point where you're kind of holding it all together until that last little needle drops, and all of a sudden it looks very different. And so all those factors contribute. You've got that underlying bone loss, the soft tissue loss, and the loss of elastin and collagen in the skin itself.
Yeah. And again, ain't no one getting away from it. I mean, it's going to happen to everybody, So what can people do? Does everybody need a facelift?
Well, it really is a personal decision, right? So if you're looking for a dramatic change, and you're at an age where a facelift makes sense. So, one of the misconceptions that people have is that facelift is permanent. It's a permanent solution. It's not. There's expiration date to facelifts too. So many people will have a revision of a facelift, 5 to 7 to 10 years down the road. So it's not forever. So you want to ask yourself, if you want to have surgery will you want it again in 10 years?
Mhm.
And does that make sense for you?
And the surgery
Right.
is really just lifting and pulling the skin. It's like, you've washed your sheets, you iron them, and you pull them on the bed, but you haven't fixed the mattress and you haven't fixed the bed frame. So it's important to keep those structures in mind. And oftentimes it can be a procedure to do as an add on if you want to, while addressing other things. And if you're going to start from the outside in, the skin, the first thing you can address is that collagen loss, that elastin loss, all the changes that happen in your deeper skin layers. And that really comes down to regular skincare. So wearing your sunscreen every day, using your retinol.
Yeah, that's a great
Um,
point. So you have different techniques when it comes to facelifting, right? So some of the
mhm,
newer techniques, definitely you have more of a repositioning of some of the
sure.
soft tissue as well. And some of the surgeons will do things like fat grafting. But to
Mhm,
your point, if they have better skin to work with, your
mhm,
results will be much, much better. So I always say, and whether you're starting Botox or whether you're doing filler or anything, the best investment you can make is really good skincare and
mhm.
prevention when it comes to your skin. And you mentioned sunscreen. So those are your
Yep.
best investments. And even if you're going to consider a facelift, doing things to improve the skin quality will make your results better.
Yeah.
And then
And
having
loss.
said that, not everybody wants a facelift.
Yeah.
That's
And
true.
that's okay.
And quit putting your face in the sun, people. Like, it boggles me. I mean, we have some wonderful, lovely, 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 lovely patients. I love them dearly, but the ones that they grew up in an era where it was baby oil and iodine for color, I think. And they laid out in the sun and they baked themselves, and the darker they were, the better. I remember being a kid and like I'm little, like in the 70s, and seeing those Bain de Soleil ads and thinking, I want to be
Mhm.
that color. Like I'm ever going to be that color. There's this trauma that their skin has been through where it's literally just sort of hangs there kind of and has no life and no vitality. Are those people that we can help or should be helping? I think so. Like I've
Yeah.
seen people with some of the biostimulators that we have now that you
Mhm,
guys have been doing. Pretty
mhm.
exciting times, really. Um,
Yeah, I think we're
Yeah.
but
seeing a
yes,
new shift in medical aesthetics where we went to restoring the volume, addressing the structure and the skin quality, but now we're really focusing on regeneration, turning back the clock. And I think we're going to see a whole lot more than that in the years to come.
Hmm.
yeah,
And
rather
to
than just throwing a bunch of filler at it. So sometimes it makes sense if the
Yeah.
mattress is deflated and you need it. You need to support
Mhm.
the tissue. But it's great what we can do now.
Yeah, and I think it goes back to understanding the anatomy and physiology of aging, right?
Mhm.
So you're not going to use one tool to fix all problems. And yes, there is a pendulum swing now to use more regenerative things. And oh, dermal filler is not great. In fact, I saw a reel today where a plastic surgeon was suggesting that the worst thing that a person could do in their 20s is to have even one drop of dermal filler, hyaluronic acid based filler, on the lateral part of their face. And I mean, that is hyperbole. And I think we're very quickly going to see the pendulum swing back. He was a surgeon and suggesting that surgery was better. Now, I would argue with that because we just talked about how surgery is not permanent. Now you're committing that person to repeated surgeries, and I would argue with that.
Yeah.
So I think similarly, we're going to see this pendulum swinging back where people will have a better understanding of how to
Mhm.
use hyaluronic acid based fillers, be
Yeah.
more judicious about it, and not do this overfilling thing or think that
Yeah.
you can give people a facelift or an equivalent with dermal filler. You can't. But you can
No.
surely make people look more rested, more refreshed, and visually look
Yep.
more lifted.
Yeah.
And that's pretty impactful and pretty significant.
Mhm.
And in many cases, people are as happy as people who we've had do facelifts. So it's really an individual thing and it warrants a discussion with the patient.
I think it's very rare. I can probably count the number of times I've had a conversation with someone who has been actually open to a facelift. I'm not trying to vilify it. I think there's some amazing surgeons out there that, like to your point, that are doing a more of a complete treatment with fat grafting and all of the likes. But the majority of the people that I talk to are like, I'm okay. Like I don't want to. I'm not trying to look like I'm 20, right? They just want to feel like more like themselves. And I think it's the light and shadow and that's where the magic with dermal fillers can happen
Mm-hmm.
for the right person. When the light hits their face in a
Mm-hmm.
different way. It's such a subtle change, but it's so impactful.
Yeah, I had some who wasn't that she was like, she's in her 70s. She's like, I still want some wrinkles. I want to
Yeah.
show the expression that I've had throughout my life, but I just don't want as much of that sagginess and drooping. I just want to feel a bit more lifted. Um, and that speaks to, again, the bony changes that you were talking about, Harpreet, and the fat pads. With that, well, often in an ideal world, with a magic wand, you would use all the different modalities. You'd probably use a little bit of filler to, help with the bed frame, and then you might use some regeneratives to try to help with the collagen and the quality of the skin, and that gives a little bit of volume as well. And then you may tweak some muscles that are a little bit stronger with some Botox, and then the icing on the cake would be the skincare options that we have that really do penetrate much deeper now and have a significant impact on the skin.
Yeah.
And I think you summed that up beautifully, Christelle. And I'm going to go back to Amanda's point about people who've really had a lot of sun exposure and have skin that has been challenged over the years. You asked the question, is it too late? And I would say it's never, never too late. We have patients in their 80s, and with the right skincare and with the right regenerative treatments, we can make a tremendous change. And then, of course, let's not forget about our lasers and our technologies, which have been impactful.
Yeah.
And I'd love to hear from you, Christelle. Like, how do you approach that person with the skin that's been so affected?
Abused.
Yeah,
They had lots
oftentimes
of fun.
I will start with addressing the skin quality, and I'll tell them that what they do at home every day and outdoors is going to have a bigger impact than any tool that I can offer them in the clinic. And that number one, they need to start wearing sunscreen and a hat. I have no issues with people being out in the sun. I love the sun. Me too.
Mm.
But I wear sunscreen every day. I didn't in my 20s because who did? And I will probably have some sun damage in a couple of years' time. But I would start with the sunscreen and the regular skincare, and addressing more the skin quality, because that's where they'll notice the biggest difference. And once we're on that and we've kind of pre-treated the skin, going back to what you were saying about our lasers, our light-based therapies can have a significant impact on addressing the pigmentation changes that you see. So the dark spots that you might see, also some of the redness you might see. And depending on their goals or how aggressive they want their treatment, you may go with something that's a bit more ablative, like a halo, which has a bit of downtime. Or you may go with something like a broadband light, like your BBL, which can target, it's kind of like a jack of all trades. It can target multiple different pigments in your skin. So they can be a really good starting point when you have that skin that's just had a beating. And it reminds me of a patient that we discussed on this a few weeks ago. Remember when you two, it wasn't one of mine, but you'd mentioned that she'd had you noticed volume loss, but the more you spoke to her, it was actually the skin quality that was the issue. And she ended up doing a BBL halo and was delighted with her results. So yeah, when skin has had a beating, I tend to focus more on the at-home skincare and then maybe adding on a light-based treatment. And once we're on top of that, then we can address the other issues, because that tends to have more of an impact than going into the deeper treatments of the underlying structure. Yeah, and I'd love to hear from you, Amanda, when you have people who have that type of skin, what are they often interested in, or what do they usually commit to doing? Because they might not be
Mm,
used to taking care of their skin, and that's a
mm.
whole nother story.
I'm not gonna lie. I kind of use skincare and education to see how committed they are. Because I
Sure.
think when it comes to somebody that has progressive skin atrophy damage, I don't even know what you want to call it. Obviously it's a lifestyle they've inflicted on their skin, and you really have to make sure that they're not thinking we have a magic wand, because
Mhm.
none of this. I always say, look, anything to do with changing the improving the skin, it takes time. Like,
Mhm.
nothing is fast. Um,
Mhm.
Filler is fast.
Yeah.
It's immediate. That's why it's so darn exciting when it's the right tool to use.
Mhm.
Even Botox is like bam, in a couple of weeks, you
Mhm.
can already see lines are starting to soften, right? Yeah, and I and then I said, "Oh, this is what we need you to do. These are the steps, and then come and see me again in 6 weeks." And really, at that point, I just sometimes decide if they get to pass go and collect $200 and do the next thing.
Right.
Because the
Well,
last
I
thing you
mean,
wanna do is disappoint somebody. So it's
no.
really about understanding kind of what do they expect to see, and sometimes they're completely reasonable, and they are committed to making that change, and
Mhm.
that's my dog. Duke, you need to. This
As
is
Duke is giving you a kiss, Harpreet, what's your approach?
Well, I wanted to touch a little bit on Amanda's point around um, people being patient or
Mhm.
using the skincare and time, and it takes time.
Time.
So we have to remember that our skin is our body's largest organ, right?
Mhm.
And just like every organ, there's physiology behind it. It works a certain way. And anytime we try to make any changes in our skin, it takes skin cycles for us to actually manifest or see the change. What I mean by that is our skin isn't inert, it's alive and it
Mhm.
rejuvenates itself in a
Mhm.
cyclical basis. So we have cells at the bottom of our skin that sort of create new cells and they migrate to the top of the skin and then they slough off and that cycle continues. And when we're
Mhm.
younger, that cycle is fairly short. And, if you're an esthetician or in this industry, you might know it to be about 21 days. However,
Mhm.
we forget that cell cycling cycle does lengthen as we get older too. So that by
Mhm.
the time you're in your 50s, that cycle might be up to about 90 days. And if
Mhm.
we say that, well, if we put stuff on our skin, it's going to take 3 skin cycles or 4 skin cycles. When you're 50, you're talking, it might take a year for you to see a
Yeah.
change.
Yeah.
Yeah. Mhm.
So it takes time. So I think people need to understand that when it comes to skincare. And to the point about a magic wand, I think that's quite true.
Mhm.
People often think of things like lasers as a magic wand, and they think they'll see
Yes.
immediate results. And you'll see faster results, 100%. But any of our technology is actually stimulating the skin through
Mhm.
heat or through ablation.
Mhm.
Right. And with the halo, I often will say it's kind of like aerating your lawn, right? You're
Mhm.
punching little holes in the skin and you're creating a stimulus. And
Yeah.
it's the reaction to that stimulus that creates the change, not the
Yeah.
actual laser,
Yeah.
right?
The
So
healing
some of
process.
our lasers will target pigment and sort of blow up the pigment. But when we're talking about collagen induction and some of the regenerative things that our lasers
Mhm.
do, it's literally stimulating your skin. So your commitment to
Mhm.
your skincare never goes to waste. Your
Yeah.
commitment to a healthy lifestyle, healthy nutrition, and all those things, good sleep, never goes to waste. And so it will all make your laser and technology work better. You'll have better
Yeah.
effects.
I find that
Absolutely.
when we're talking about those ablative lasers that will stimulate that collagen, it'll be really good for more of those superficial lines and those the skin quality, but
Mhm.
maybe not as impactful on sagginess as other tools that we have.
Mhm. then we start to get into the bioregenerative treatments that can give you some volume. And when I look at skin itself, we already talked about the bone, right? We get bone resorption. We already talked about soft tissues. We get soft tissue resorption, and we can do dermal fillers. But when we look at the skin, there's a pattern to the skin aging too. So the epidermis gets thinner, the dermis gets thinner. It starts to slip on itself. You get this crepiness that happens, and we get dyspigmentation within the skin itself. So those are aspects of the skin that we can change as well. And we can thicken up the skins using growth factors because it does thin. So if you look at people in their 80s, they so often complain of, I bumped up against something and I got bruised, and I don't even know how my skin sloughed off. They'll get abrasions super easily because the skin is thinning. So that thinning aspect of skin aging, we can treat with bioregenerative treatments like Sculptra. We can use growth factors. We can use platelet-derived growth factors. We can use PRP.
Retinol.
And
Even retinol
too. Yeah, good old retinol.
and
So
sunscreen. Just wear some damn sunscreen. Oh my God! All I'm saying is the whining over. I didn't like it. Just find one you like and put it on. It's
the
not that hard.
sunscreen.
We see
I think we're
people.
lucky nowadays with the amount of choice we have with sunscreens, because that was
So
definitely
many choices, like whether
yeah.
you want a powder or a liquid or a cream, but Harpreet can speak to this. We've had patients that have come through on the skin cancer screening side of things that we've got just wearing sunscreen, like we're talking basic, and year after year, just from adding sunscreen, nothing else. They don't do anything else. Their skin starts to look better.
It makes a huge difference. So here's the thing with our any patient, once they have skin that's been damaged, sometimes they feel pretty despondent. At least I see that. Sometimes they do feel like it's too late, and they feel like the sunscreen is a waste of time, because what is that going to do? They feel like it's only going to prevent future damage, and how is it going to affect them currently? But what I like to explain to them is that UV radiation is damaging on a daily basis, and whether it's cloudy and whether it's winter, the ball of radiation is in the sky. And so there's visible and non-visible radiation that our skin is exposed to. And every time our cells get hit by that, the DNA gets damaged slightly. And then it's the job of our immune system and scavenger cells to go and clean up all that mess. And so we have old stuff sitting there, as well as new damage that comes in every day. And if you wear sunscreen, what you're doing is you're preventing new stuff, new damage, so that your cells, your immune system cells, can go around and scavenge what's been done before better. They're not distracted by the new stuff that's going on. And
Yes.
sometimes when I explain that to them, they get a little bit more hopeful and they understand. And so then when you have that commitment to wear the sunscreen every day, it allows your body to protect itself and to repair itself, and you see it. And that's, feels really good for them. So I try to give them that encouragement. It does make a difference. Try it out.
Yeah.
Amen. I totally agree. It's like there's a little battle that's going on all the time. Your skin's kind of trying to protect itself. And, you're just putting in the troops in the very front so that, yeah. I got to think of another analogy that's better. Back to saggy, because that's what we were talking about.
It was, but the sunscreen does impact it, because it'll impact your skin's elasticity if it's very sun damaged, and it will sag because it's lost its elasticity. Anyways, going back to that patient you wanted to mention.
Oh yeah, but again, other than you should all be wearing sunscreen every day, don't even talk to the hand if you're not going to find a new channel. Because I'm sorry, it's just easy. You just got to find a good one, and your skin will thank you for it. But it is still very unique to everybody in terms of how that saggy kind of comes on. So we had a patient a couple weeks ago, and she was a bit tricky because she was 70, 71, had done nothing. And I'm looking at her and I'm thinking, what? You've done nothing? Because her cheeks were so darn good. And so it was interesting that she didn't actually have much. The bed frame, the bone, was really well preserved. I don't know, I guess it's just genetics, lucky, right? Um, and really, it was more kind of soft tissue that needed to be, plumped up in a few areas, and then again, work on the skin. So saggy can look very different for different people.
Yeah.
Yeah. So various genetic factors, right? She may not have had much bone loss, so she's not prone to things like osteoporosis. She might have a high calcium diet and that type of thing that impacts bone resorption. And then going back to the structural issues that we sort of talked about last episode, some people have shorter chins. And when you have shorter chins, you are going to look saggy and jowly faster.
Yeah.
It's just,
Thanks,
just the
Grandma.
way it goes.
You'll start looking sad, and then the sadness will turn into sagginess.
Yeah,
Sad to say.
totally. My
Yeah.
family all over.
Yeah. It,
Mhm.
yeah. And chins are not something we're used to looking at unless you're in aesthetics, right? And so restoring chin length and chin structure can be really impactful when we're trying to prevent saggy and treat saggy. And the one caveat I will say there is that when you are an injector and you're doing chins, make sure your chins are 3-dimensional.
Oh,
Yeah.
please.
Yeah.
Just, I can go to this injector and they're going to put one syringe right here. Yeah, that looks awesome. Not. We've seen it, right?
Yeah.
It
It's a
you have to
sculpting.
look good from every angle.
Yeah.
Yeah.
There's a lot of sculpture involved in the chin and in the jaw when you're restructuring that, especially if there's been, a lot of bone resorption and you're starting from a point where there wasn't that much support in the first place.
Mhm.
And then you still have to look like you. I was
Yes.
thinking, we
Yeah.
have a patient that she's lovely. I think she's got to be pushing 70 now, but a very kind of heart-shaped face. And she's tricky, right? Because you have to maintain, like, you're not going to give her a big, wide Pharaoh's chin, so you can improve it, but you have to always be thinking about, well, what did they look like 10 years ago, right? So chins, I could talk about chins all day long. I could wag my chin about
Maybe we'll
chins
do an
forever. We'll have
episode
to
on
do an
chins. Yeah.
episode on that.
Yeah. If
Yes,
you want to
I
hear
think
more
that's
about chins, maybe send us an email or write a comment down below, and we'll make sure we'll get some stories for you about chins and factors that we consider. Before we wrap up today, is there any advice that you'd give your 30-year-old self? If you could speak to your 30-year-old self.
Oh God, don't go out with that guy. Do
Skin.
not.
Adhesion
Oh,
to skin. Chips.
Oh,
That's another podcast.
that was my 20-year-old self. I guess I married the 30-year-old, the one I get. So that worked out okay. But 30. Oh, get Botox sooner.
Okay. Harpreet?
That's what I would have said.
Yeah, I started Botox when I was in my 30s. I started doing Botox when it first came out, like for other people. But I think being more diligent about sunscreen, oddly enough, because there weren't that many options for people who were highly melanated like myself. So things would turn me blue, right? So, but finding a good sunscreen, that would be one for sure. And the other one, and I feel like this is another show, is learn about lasers and people who do have pigment like myself. Not all lasers are the same. And I can tell you a story about an IPL burn that I had on myself and how my interest in lasers started. So, yeah, I would say don't do the IPL. That would be my other advice.
I think
Unless
it's
you're
still
me, and then you can light me up.
Yeah, if you're me, that was just to me.
But if you've had melasma, you probably don't want to be. You want to be careful too. I think
That's right.
lasers isn't a whole episode in itself. So we've got chin and lasers. Maybe we'll take a vote as to what you would like to hear us talk about first. And for me, I think it would be sunscreen as well. I was the one who had the sunscreen in her foundation because, well, I never burn. And sure, it'll be fine. And I have pigmentation because I was in Ireland all on my driving side because we drive on the other side of the road.
Yeah.
Again, there weren't that many good options. I'd be on the oilier side and they just made that a whole lot worse. And, when you're battling shininess, that's not what you want. But I'm happy to say that there are so many really, really good options that we have nowadays. That weren't really available 10 years ago. So on that note, I hope you enjoyed today's episode. And next time we'll be potentially talking about your aging Achilles heel, unless there's a huge push for us to talk about either lasers or your chin.
And if you're feeling saggy, come on down, give us a call.
Bye for now.
Until next time.
Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on the Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at Lotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.